Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Stephen Pearce and Bruce Berger. Thanks for joining us today, Stephen and Bruce.
Thank you.
Great to be here.
I'm happy to have you. So we met on LinkedIn, and by way of introduction, Stephen Pearce is a practicing gastroenterologist who was practicing up until probably 30 seconds ago, right, with your surprise procedures?
Exactly. Yes.
So I'm glad we worked this out. And Stephen has a passion for creating positive social impact through media. His company, L36 Media, produces educational entertainment documentaries, biographies, and dramas. He created a poignant and beautiful film, Love Evolved, where he shares his own transformative journey. Stephen aims to raise awareness and inspire action on various topics such as mental health, education, and personal development. He's engaged with transformative storytelling, and on top of all of that, he's a really nice guy.
I couldn't have said it better myself.
Okay. And Bruce Berger and I have followed each other for a while on LinkedIn. And we finally had a long overdue conversation in February. And I think it was Grace May.
Yes.
Had said we should connect, and we had been following each other. But I was so glad she actually said that, because we're like, let's get this done. And we had a conversation. And Bruce is a pharmacist by training who returned to school and received a PhD in social and behavioral pharmacy. Bruce's focus has been on motivational interviewing for 20 years, helping healthcare professionals help patients manage chronic illness and build authentic relationships. His content is great, and he's also a really nice guy, as you'll see. Today we'll be talking about Stephen's journey to creating his film and what is transformative storytelling, and Bruce's journey to his PhD and his focus on motivational interviewing. So we could start with Stephen. What would you most like our audience to know about you as we begin our conversation?
I'm a really nice guy.
Yeah.
That's it. I'll take it. No, I think for me, speaking with you is about mental health advocacy, specifically in healthcare, because that's my world and that's where a lot of my mental health dilemma actually started. I'm really here to advocate for other physicians and nurses and everyone in the healthcare industry. It's a tough industry to be in, I have I guess a unique perspective how I found my way out of my mental health disorders that developed in healthcare was through filmmaking.
Mm-hmm.
And so I never thought that would be something that I would bring back to the table for everybody else in the healthcare industry. But it was a really fascinating journey. And, it took me from, experiencing burnout. But as I actually talk and share my story, a lot of physicians actually tell me, no, this is beyond burnout. You're dealing with actually a trauma response, developing, anxiety, and I developed depression actually doing my work, going specifically through training during residency, but into fellowship and beyond. But I eventually, when I got out into partnership as a gastroenterologist, I felt like I needed something more, and eventually I turned back to a childhood dream of filmmaking, and it was a great choice for me. So it ended up being this very therapeutic process, and I got to do it in this very unique way where I got to meet very interesting thought leaders about various topics and wisdom and knowledge, um and eventually I came to realize that camera and getting in front of that lens and sharing my story and how cathartic that could be, but also in how I can share information with other people in a I would say in an entertaining way, but still it's knowledge, it's wisdom, it's important pieces of information to share in unique and hopefully artistically tasteful ways. So yeah, so that's what I want to share with everybody, and I just think that it allows you to, I don't know, it's almost like I could explore the problem without having to say I had a problem, is I think what I was doing with that. And I just think that for a lot of physicians that we still, despite all of the efforts and people like you, Kim, there's still a lot of people that are out there that say, hey, look, I'm not going to admit I have a problem for various different reasons. And I think we're overcoming that, and that's the work that you're doing, and that's why I'm here. But for you to go out and just use a camera and go and explore other people's lives and your own life, it gives you an opportunity to explore concepts and universal truths in a way that doesn't put you in front of a therapist. And it might give you at least an avenue. And I'm not saying don't use therapists and don't use these things, but it gives some of us an opportunity to at least start to develop some degree of vulnerability that you can actually get to the point where you say, okay, now I can really use the help, or now I can get there. It's, to me, it was like a real life's hero's journey is what that was.
Yeah, well, thank you. And part of it speaks to creativity, and for some people it might be writing or photography, and for you it was filming. And I've seen the film, and it's beautiful and well done.
Yeah. No,
So yeah,
thank you.
thank you for sharing that, Stephen.
Yeah, thank
And
you.
Bruce, what would you most like our audience to know about you?
Well, I've actually been teaching motivational interviewing for 35 years. I actually brought it to healthcare. Uh, when I was practicing pharmacy, one of the things that I noticed was how important the relationship was between the patient and me. And I decided to go back to school to learn more about how that worked. And so I came upon motivational interviewing, and motivational interviewing was really developed in the areas of substance abuse. And I thought, my goodness, and it's still the most effective intervention for patients with substance abuse problems, which I find interesting because healthcare has hardly ever talked about it through the whole opioid crisis, and yet it's still the most effective intervention. Anyway, the thing that motivational interviewing did for me, and it's kind of a misnomer because you're really not talking to a patient to motivate them. You're talking to a patient to explore their motivation. In other words, how important do they think it is to treat their diabetes, their GERD, whatever it might be, and what are the behaviors that need to be engaged in, and how ready are they to do that, and if they're not, what's keeping them, with the idea that ultimately it's their decision. And what I find interesting, in 1976, a researcher named Bonnie Svarstad, who happens to be a very good friend of mine, did a landmark study that showed that the relationship between the healthcare professional and the patient is still the best predictor of treatment outcomes. And here we are still talking about it. What I want people to get from me is so much of what we're talking about in terms of healthcare reform has to do with, as you were saying, well-being, whether it's physician, pharmacist, nurse well-being, or patient. Well, and we want to produce better, more effective, and kinder relationships. Who could argue with that, right? But what we don't seem to want to do in healthcare is invest in the kind of training to do that in the same way we invest in teaching people about diagnosing or pharmacotherapy. In other words, we really can, for example, if you have a patient standing in front of you who says, I'm not getting a flu shot this year. I got one last year and it gave me the flu. Well, we know that's not possible. And guess what most healthcare professionals say to the patient? You can't get the flu from the flu shot. I always tell healthcare professionals, if you can put the word stupid on the end of a sentence and it doesn't change the meaning, you're going down the wrong path. And so as soon as you say to that patient, you can't get the flu from a flu shot, you lose the patient. You've caused face loss, and they stop listening. But if we just said, so because you got the flu shot last year and you felt awful, you're kind of wondering, why in the world would I do that again this year? And the patient now knows somebody listened without judgment. And now I can say, would you mind very much if I just shared a few thoughts with you, and I'd really love to hear what you think. That's what a relationship is. Well, we can teach people how to do that and do that with even more complexity. But most of us believe we'll just figure it out. And guess what? Mm-hmm. The rate of non-adherence to health behaviors has not changed in 40 years. The way we talk to patients has not changed in 40 years. So my message is, if we want better relationships, we have to train those with the same rigor and science that we use to train physicians in diagnosing and pharmacists in understanding pharmacotherapy, etc. So that's my message.
I love it, Bruce. And Stephen, does that bring anything to mind for you?
Oh, I'm thrilled. I'm sitting here saying I can't wait for him to give me more examples because I'm going to go use them in about an hour.
Okay. Can I give you a great one?
Yeah.
And I'll give you. I do have a book that's in second edition, by the way, on motivational interviewing for healthcare professionals. That's what it's called. And we had a woman come into the pharmacy when I was teaching at Auburn University, and I left the university and retired from the university in 2009 to do the kind of training I do. But anyway, we had a woman come into the pharmacy at the university. We had two pharmacies, one for faculty and staff, one for students. She had a prescription for diabetes, newly diagnosed. And she looked at the pharmacist, and I was kind of precepting and helping students, and said, I have this prescription. Doctor said I have sugar, but I'm not going to get this filled yet because I feel fine. Right? The pharmacy student actually kind of froze. All right. Now, I stepped in and I said, so because you're feeling okay right now, you're kind of thinking you're going to wait until you start feeling bad or have symptoms, and then you'll consider taking it. And she said, exactly. And then I said, okay. I said, would you mind if I just share a few thoughts with you? And I'd love to hear what you think. And she said, well, you can share all you want, but I'm probably not going to take it until I have symptoms. And I said, fair enough. It really is your decision. Do you notice how non-threatening all of this is, right? And here's what I said. And this is one of these you can steal if you'd like. I said, our body needs sugar. It needs a certain amount of sugar to function properly, to have energy, for our organs, our nerves, our blood vessels to work properly. When you have diabetes, the body has too much sugar. If I can draw an analogy, I want you to imagine a continuous bottle of syrup pouring on pancakes. Continuously. Over time, the pancakes start falling apart because they get saturated with too much sugar. When you have diabetes, something similar is happening in your body, that everything starts getting soaked in too much sugar. And you may end up with problems with your kidneys, your eyes, your heart. At the point at which you start feeling symptoms, damage has already been done, and oftentimes it's not reversible. This medicine can help keep that syrup or sugar at a level that's helpful to the body, not harmful. And I then looked at her and said, where does this leave you now in terms of using the medicine? And she said, nobody ever explained it to me that way. If you timed that, that would have taken about 2.5 minutes.
Mm-hmm. And it's simple and powerful.
Yep. That's the idea. You've got to be able to, no human being is going to engage in a behavior that's not important to them, or that they don't have confidence they can do. And this is where education alone fails. If the education does not meet the needs of the patient, it's going to fall on deaf ears. I also tell people, if education was enough, no healthcare professional would be overweight or smoke. But we know that's also not true. So
another good point. Yeah, for sure.
Yeah, the non-judgmental confrontational or non-judgmental interaction. I was terrible at that when I was younger, and when I first got out of fellowship, I would have patients leave my practice, and I said, "Why are you leaving my practice?" And and I was so focused on every single question that I had to ask that I would completely forget that there's another soul on the other end of that conversation, interacting with me. And in these travels that I did when I was making my film, I spent 2 years in a course for spiritual psychology. And they did this very interesting practice at the end of every meeting that we had. They would call it seeing the loving essence. And you would sit there with these somebody else in the class. You'd hold hands and you'd stare at each other into the eyes. It was for like a minute, and you just looked at each other eye to eye. And that was over 2 years. I started to bring that back into my practice where I would just see the loving essence of whatever journey this person is on, and how can I help them on their journey and be of the greatest help that I can be. That revolutionized the how people responded to me. People stopped leaving my practice, and they actually liked me. And I was like, wow, that's great. That's totally different. So I know, so I get it. And it's like, man, we get so caught up in, oh my God, I have to check every single box, that you just forget that there's this soul going through something. And this
Mm-hmm.
motivational interviewing, I'm so fascinated about it, because I know that there's little nuances, just like you're saying, that can make such a big difference. And I'm always thrilled to hear more of them. So thank you for that.
Yeah, well, you're welcome. Yeah, because we're human beings, we often forget we're connected. In fact, it's the illusion that we're not connected that gets us in trouble. And part of what you're saying, in terms of what you were doing, is you were reestablishing that connection. I
Yeah.
like to tell people that uh, the encounter between a patient and a healthcare professional is a meeting of experts. Obviously, you're an expert in terms of gastroenterology, but the patient's an expert on how they're making sense of whatever you tell them. And
Mm.
that's what
Yeah.
I that's what we have to listen for. Do they really, how are they processing this? How are they making sense of it? And a lot of times asking a simple question like, so what does this mean to you? Uh, will reveal so much about where the patient is and their readiness to do something.
Hmm. Yeah, for sure. Yeah, thank you for sharing that, Bruce. And Stephen, did you want to share a little about how you actually went on to do the film, like either how you were feeling right before or how you actually took that step and traveled around the world? Was there any a thing you wanted to share about that process?
How did I actually embark on the journey? Um, I'll tell you what happened was that eventually anxiety started to creep out, not just within interactions with other professionals in healthcare. It became part of the interaction with my patients. And then eventually it became interactions with my family and friends. And so once I couldn't really respond well to family and friends, and I knew that my life was going to be that way unless I did something else, that's when I felt like I had no other choice, but I had to do something. And like I said, I did seek counseling, and I did seek at the professional level. But like you said, Kim, the creativity part, because I was such a creative in the first place, I wanted to be a filmmaker when I was a kid, and that creative aspect, I had lost it, in studying for exam after exam
Mm-hmm.
and boards after boards, and I wanted to get it back. And by getting it back, I got this piece of me back that then allowed me to interact with people in a much more authentic way. But that was it. I mean, I had to make that choice. Otherwise, I knew I wasn't um, I wasn't going to have the experience with my friends and family that I really wanted.
Mm-hmm. Hmm.
Yeah.
Something that I have found interesting relative to what you were saying about acting in an authentic way is that one of the things that occurred to me when I really got really deeply involved in motivational interviewing, because it's person centered, is I started engaging the same skills in talking to my doctors.
Mm.
And Kim, I know you saw this story about my ophthalmologist. I got referred to this ophthalmologist for cataract surgery, and it was ironic because he walked in and he's quite shy. He's a young guy and he's introverted. And so the irony is, here's an eye doctor that was not making eye contact. And but what I found was, what I started asking him after he did the cat, I asked him to explain what he was going to be doing, and he was very good at that. I asked during the surgery if he would mind, even though I was using, even though they gave me Versed, would he mind telling me what was going on? And he did. When I went back to his office to be checked, I looked at him and I told him how much all that meant to me. And I also asked him, how different is surgery for him now in terms of his confidence and all that versus when he first started? And I also thanked him for my vision and how good I could see. It changed our relationship totally. And the point being that just because you have Doc, MD or PhD or whatever after your name doesn't mean you're not a human being that wants to be valued and noticed. And if I ever need anything, he works me in. So you want better care from your doctor or whoever, treat them well. They work hard.
I can identify with that. I mean, I'm just thinking that I have several different patients, being out here in practice for the last almost 10 years now, that are like that. And when you get thanked for something that, people don't typically thank you for, and you don't think about it, it's such an eye-opening event. Even to this day, somebody thanks me, it just catches my attention for some reason, because I just think, it's not that I feel like the work that I do should be taken for granted, but it's hard to put my finger on it, but you do feel appreciated. You do feel valued. Even though I'm not really sure that I need it on a conscious level, but maybe on some kind of subconscious level, I get that. I'm like, wow, and it does, and it changes the dynamic of that relationship. And I can think of 4 or 5 different people specifically that I'm very, very close to, and very, very, I care deeply for them, as patients, and really want their well-being. But I know that we have this connection when you interact with me that way. So yeah, coming back from a patient to a physician, it's equally welcomed.
It creates trust.
Yeah, yeah.
I mean, it's interesting. When he first met me, he knew what I did. He knew I was studied health psychology and health communication, and he almost got a little bit. Oh, are you analyzing me? And I said, not, not at all. I said, not at all. After that little episode, he looked at me and he said, so tell me, given what you do, how do I get these people to use their eye drops the way they're supposed to before, during, and after they've had cataract surgery? He trusted me now to help him with information. Isn't it amazing when we treat human beings like valued human beings?
Did you want to share what you said that people could extrapolate to other things?
Well, he as you may or may not know, when you go through cataract surgery, you got to use a whole bunch of eye drops for several weeks, several times a day, and it's not the most fun. And he says, I don't get why they just had eye surgery. Why don't they want to comply? And I said, so what have you done so far? He says, I usually get very parental with them. And I said, how's that working for you? And he laughed and he said, not very well. And I said, what would happen if you changed it up and said, I'm really worried about you? And he said, oh. And I said, what if he said, I'm really worried about you? He said, I worked really hard during the surgery to do the best job I could for your eyes, and now it's up to you. And I would hate to see you undo that. What's your understanding of the importance of each of these eye drops? If I've not done a good job in explaining that, I'd really like to. He told me the next time I saw him, he tried that. He said, it was amazing. It was just amazing how it changed the relationship. So how does saying to somebody something the effect of, what's wrong with you? Why are you not using these drops?
Yeah.
Why do we expect that to have people go, yeah, you're right, I'll use them, versus I'm concerned, I'm worried.
Hmm.
So
Yeah, the tone, the inflection, the way you say something and what you say is all so important.
it's powerful.
Um, but I'm just curious, because we deal with people, for two instances I can think of. One are alcoholics. So we deal with people that are just experiencing cirrhosis for the first time. Maybe they had a variceal bleed or ascites or hepatic encephalopathy. Um, and often as gastroenterologists, we're asked to come and see them in the intensive care unit. And we typically will have this conversation about alcohol. We have to address it.
Mm-hmm.
That's a hard one to have. That's a very hard one to have, because of the disease that I find that it is. And either they're, on their last leg trying to get to Alcoholics Anonymous, or, they succumb to the disease. But I have found that conversation so challenging over the years, so challenging, so hard to do.
It's especially, when we were talking earlier about training, that kind of conversation is especially one where training is really important. That's not to say that you can't pull it off without any formal reading or whatever. I'm just saying, knowing that people like alcoholics are often very shame based,
Mm. Hmm.
staying away from anything that sounds like judgment, anything that
Right,
sounds like, why don't you get this?
right.
And instead, again, talks about, I'm really worried, asking patients questions about what their understanding is, what can happen, and how important is it for them to prevent that? That's a different conversation.
Yeah, yeah. Yeah, over the years I have found that we I have a couple of partners that have this kind of militaristic approach to it that they took, and over the years, I have adjusted towards this more non-judgmental approach that I'm here to, support you in any way that I can.
Mm-hmm.
And part of that is to understand what death from cirrhosis looks like. So we have that conversation, and just look at what the progression of this is. And a lot of times I try to bring up, and I don't know if this is right or wrong, but I do bring up Alcoholics Anonymous, because of the degree of recidivism with that. Um, and I don't know. That's the one thing that I just want to pick your brain, because I never see that my patients make it. Often they don't make it there. They typically feel like they have enough support within their community that they don't need it. And then, I have watched many of them pass, because they couldn't beat
Yeah.
alcoholism. So it's just such an interesting motivational interviewing. That's where I was like, I will read this book and I would want to learn more about this, because I would love to apply it to that specific scenario.
It's interesting, and I know we're getting short on time. Miller and Rolnick, the creators of MI, clinical psychologists, both discovered that, especially when people are shame based, tough love doesn't work. That more military, as you said, type of approach, it just doesn't work.
Yeah.
It drives people away, and so there is learning to be done. And we do our patients a disservice when we leave that out of the formal training. Again, we would never teach anything but evidence based medicine. Why not teach evidence based communication?
Mhm.
So
I love it. Yeah, I love it.
Yeah, that is very important. Stephen, was there anything else you wanted to share about transformative storytelling if people don't really know what it is?
Transformative storytelling. Yeah, let me shift gears. I'm so fascinated by what Bruce has to say. Now, so transformative storytelling, it's just using this, it's really looking at the story that we tell ourselves internally, and using that examining that as a conduit for growth, self-discovering growth, and reaching a place of authentic self-expression is what I would say. But it's not this, it's not the story of part of it is the story of our lives, but it's really what you're telling yourself inside of your head. What are the beliefs about who you think you are? And where are the obstacles in the way for you to reach authentic self-expression? And so we look at the obstacles, we look at how that translates into the story of your life as well, but it's really that internal piece. Because I found so much therapy in that and exploring that, and that really helped me reach greater levels of creativity.
And I bet you it helped you with greater levels of really listening deeply to people.
Yeah, yeah, 100%. Yes, absolutely.
Hmm. That's great. Well, Stephen, as we're winding down, do you have any top tips for your colleagues from seasoned physicians to medical students or even those considering med school?
Do I have any? Sorry, say that
Like
one more
top
time.
tips, like any suggestions that you would want, like people in med school or residents or attending. So, any of your best advice or top tips?
Yeah, I would say listen to Bruce, uh, because that's so what he's talking about is so important, and I would say that they really need to. I found that you really need to know yourself coming into this. I don't think that I really knew myself coming into medical school and training. And my God, how can you? I mean, you're so busy studying. It's so hard to get a grip, and you don't really, not all of us, I think, really know what we're getting into when we come into healthcare. And really having an understanding of who you are and I just think that that is so critical in dealing with the day in and day out work that we do for decades of your life, and really having a good grasp on that is so important, and it can really change the trajectory of your career coming into this. And I know that in the academic world that, I know that there's a lot of brilliant minds, and I will just say it openly that I find that a lot of brilliant minds can be quite dysfunctional in certain ways, specifically at the level of emotional intelligence. And so, how can we foster greater emotional intelligence within our leadership, within the academic world, is something that I think is a very important topic. It's hard to do. Those guys are really smart. It's hard to talk to really smart people and tell them to think differently, but I
See,
think it can be
what
done.
I think you're talking about is how do we encourage introspective practice
Yeah,
in all of us, you know.
Hmm.
yeah, yeah, yeah.
Hmm.
So true.
And I think what's difficult is as you're coming into adulthood and trying to know yourself when you're a resident and everything is put the patient first and you're taught to suppress your own needs, whether it's to go to the bathroom or eat or sleep. So
Yeah,
that's totally at odds with getting to know yourself.
yeah,
I
yeah,
think it's very hard to be introspective when you're trying to survive.
Hmm.
yeah. And that's what I did. I mean, I tried to survive.
Yeah.
Yeah, and so that, I do think that there is progress. And Kim, you're part of that. And I'm so glad that I found you and Todd and everybody that you've introduced me to. I mean, just wonderful people that I say, my God, there is an actual different world out there. It is changing. And so I'm proud to be part of that.
Yeah, all these connections are quite a blessing. And Bruce, do you have any final words that you'd like to share with our audience or any suggestions for patients who wish to support their doctors?
I I would just really think about the relationship as a meeting of experts, and I would say to healthcare people again that you really have to explore the patients how they're making sense of things, and that information has to be education has to be personally important to the patient. If you're talking about things that just don't matter to the patient, you're just going to lose them.
Hmm. Yeah, thank you, Bruce. That's so important. How can our listeners get in touch with you, Bruce?
Well, they can go to my website. That's how they can also find the book and other resources that are out there. MI for motivational interviewing, HCP for healthcare professionals.com, MIHCP.com.
Okay, excellent. And how about you, Stephen? How can our listeners get in touch with you?
I'm mostly on LinkedIn. If they want to just connect with me on LinkedIn, I'd be happy to talk to them.
Yeah, LinkedIn for me too.
Okay, me three, right?
Yeah.
That's how we all connected. So,
It was great to meet you, Stephen, by the way.
yeah, Bruce, thank you.
okay. Well, I love introducing people to each other. This is like so much fun. And I just wanted to thank you both for being my guests today, Stephen and Bruce. I loved having you and I love this conversation, and I'll publish it in a week. I can't wait for that. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Love it.